come to that, is that a lot of doctors feel very helpless and powerless. You know, you read a newspaper article, and typically it's a very one-sided view. And the reason is, for example, the patient complains, goes to a newspaper reporter, and when they ask the doctor for their perspective, the standard answer is, sorry, I can't talk. Because the insurance company will tell you, don't talk to the relatives until it goes to court, which means everything becomes very one-sided. Is there something we could do about that, Ambdekar? Why can't we have perhaps a more senior body of professionals who could perhaps stand up and explain to the journalists before they wrote the article that these are what the facts of the matter are, and that it may not be as simple as it appears, or you may be getting a distorted version, but the doctor is too scared to provide his version of things.
In a medical institution like this, for example, can't the dean or somebody do that? That should be the right thing to do. Because you can't wait for a committee to be formed and all that, and call the committee and all that. The next day, the people who are in constant office in the institution should be able to deal with the journalist. I think we have been always talking about patient protection, but I think there is also a point to be made about doctor protection, if you ask me. Take, for example, doctors beaten up sometimes. Take, for example, nursing homes burnt, for example, you know, for no reason at all sometimes, and there's absolutely no cause for such disgusting behavior. So there is a point in that also, you know, you need to look at the doctor's side also in this particular...
I completely agree. I am a practicing doctor. But in fact, your point is well taken, that perhaps if journalists were aware of the fact that they could call the dean of KM Hospital or someone, that in case something happened, they would be able to get a reasoned opinion from someone who could be trusted. So they didn't misreport. That's what my...
You know what the media is like. You know, you have very many young people in the media who want to go quickly to the top. And the best way of doing this is writing things which are as sensational as possible. That's the
I don't think that's fair, sir.
It is very fair.
Think that we have
I remember a long while ago, a surgeon, my patient, a surgeon, the patient had a lesion in the apical segment of one lung, which looked suspicious to be malignant, and this good thoracic surgeon removed that particular segment of the lung, not the lobe. He managed to remove the segment of the lung. It was a patient who had a lot of other background problems, so there was no doubt about it that it was a high-risk surgery. He did it, and the patient became bad. Thank God he didn't die, but he became pretty bad after surgery. He was in the ICU, he was on a ventilator. And there was one blessed doctor, you know, who knew the relatives very well. And she went and reported it to the Times of India, to the media. And they sent a young chit of a girl, you know, who behaved so rudely, so damnably rudely, and said, I'm going to report this, all of you all, you know, are out to kill people, you are out to take away people's organs, and all sorts of rubbish like that. So what was the idea? Ultimately I find out this is one of those ambitious media reporters who was very keen on getting promotions. And the way they do this really is to sensationalize news. You see that on the TV, you see that in the paper, it's all there. So you know, the canker of corruption, if not corruption, the canker of distrust, the canker of not dealing well with human beings, the canker of being unethical, you know, it's not just with doctors and patients and human beings, it's spread to all endeavors of life, all human endeavors. And the media is certainly one of them, if I may say so. No question about it.
I'll tell you what happened about a month ago at Udwadia. We had a child transferred from outside. This child was in sepsis with a gangrene of the toe. And we realized that there was another family member who had died a similar way. So we started thinking this is probably some congenital coagulation defect. And we tried our best to save that part of the toe, but it went on increasing, and the only solution to save the life was an amputation. I myself had taken lots of time to convince parents, counsel them, telling them that this child has some rare disorder and we need to investigate further, because even if we save this child, this may end up with some other complication. Having done all that, when it came up to amputation, the parents said, we came with a little small gangrene, it has spread, it was because of the negligence of your doctor, and now we want to go against medical advice. They just came around just across. and we were following. They had to be amputated. And within a week, he started developing a gangrene on the other side. But what happened meanwhile? Same night, the media person phoned me and said, I heard that because of the negligence of your doctor, a young child is losing his limb. I said, no, that's not true. No, but I know it is true. I want to know what happened. I told her that this is a very rare, complicated disease. You come tomorrow to my office, I will explain you everything. I'll put across to you everything. She said, I want to make a story tonight. I said, I'm sorry. I'm sorry, I will not. I said, you will not understand. She said, why not? I said, 99% of doctors may not have heard about this. How can I explain you that? She reluctantly accepted, came next morning. I spent an hour with her, explained her everything. Next morning, I opened Mumbai Mirror, headline, negligence of doctors loses this. Now, what do I do? Okay.
Did she get a promotion?
Now, this is what it is. So I don't think we can control exactly what sir said. This is a young girl who wants to get hired and she makes a sensational news which nobody else has picked up, and then she will be probably given a promotion by an editor.
So
now,
my
how do I go back?
If we continue allowing this, things are just going to progressively get from bad to
So
worse.
it's difficult. I know that in this complex, Udwadia and Tata, every time there are enough number of media people, I tell you that. I've had a person who came to my office and said, can you help me? I have a child who is crying and nobody is looking at him. Please look at him. I said, is he your relation? No, I was at KEM. I saw in the casualty the mother is holding the baby. Sir, nobody is looking at it. I said, no, I will bring the child to Wadia. I knew she would pick up another crying child from Wadia and bring it to KEM. Now that is her job. Okay, but how can you prevent this? I told my management, they wrote 2 times, not even an acknowledgement of a letter. Not even an acknowledgement. Now who is going to fight on all this? You just swallow this and keep laughing.
Now this particular patient fortunately, very fortunately lived, you know, but I was dreading what would have happened if this patient had died. You know, this is how it is. Ultimately they didn't publish it because, you know, I made it very plain that, you know, you are a disgusting creature to behave like this. You know, you pretend that you know a lot of medicine and surgery when you know nothing about it. This is what it was. What happened unfortunately was, it wasn't a tumor, but it was tubercle in the apical segment. Now how the hell was one to know when it looked like a tumor, it turned out to be tubercle? This is what you call judgment, but it's a judgment. It's not even a judgmental error. It is one of those things which can happen anytime.
I think part of what worries me is that people are no longer willing to give that benefit of the doubt or that sympathetic ear to the doctor anymore. Partly, of course, it's like you said, the press. Partly, it's a lot of judgments which High Court judges, with hindsight wisdom, with 2020, after everything is over and done with, will then pass very scathing, critical remarks about doctors who are meant to protect patients' life end up causing harm. And I think all this has an insidious effect which keeps on adding up. And I think we just become silent spectators. And what really worries me is that if doctors don't feel trusted by patients, they will then behave in that particular way. That's why you see so much defensive medicine being practiced, because the doctor says, I'd rather do 10 tests. I don't want the patient to come back and tell me, you didn't do the 10th test and therefore you missed the diagnosis. And that's what the big concern is. I think we're going to be winding up. I think the most important message I need to
There is a question, sir, from my side and from the media, by the way.
That's fine, that's fine. We're closing now. We're welcome. You know, we're all here. You can come and talk to us. My one thing when I need to close is very simple. I think we need to understand that doctors are human beings too. We took up medicine because we want to help people to get better, and we respect our patients, and we would like our patients to be able to respect us, to trust the fact that we are trying to do our best for them, and not to extrapolate based on one article which they read in the newspaper or one something else which they see on a TV channel that all doctors are crooked. Because I think if you start taking that approach, you are damaging the entire medical profession, as a result of which really no